So today I want to talk about allergies. Are you allergic to something, or do you know someone who has frequent allergic reactions? Now, there are so many people that are allergic to several different things in the environment. Some are allergic to food, certain foods, nuts, the fur of animals, perfumes, powder, soap, some even medications. Okay, there are so many things that a lot of people are allergic to. So now to the main focus. When you go to the hospital and a doctor prescribes a medicine, this medicine, mostly we call them antihistamines. They are supposed to suppress whatever you are exposed to, which is the allergens that you are exposed to. The antihistamines are supposed to suppress or reduce the effect of the allergens. So when you go home and you use the medication for a while, and maybe after 2 to 3 weeks, you still feel that, no, it seems the medication didn't work. Then you are back to the hospital. Doctor, then the medication you gave me the last time did not work. I'm still having the reaction. That is not the case. Do you know what the problem is? When you went home, whatever it was that triggered the reaction the last time, you got exposed to it again, which is why the reaction came back. The medication that was given to you is not supposed to cure the allergic reaction. It is only supposed to reduce the effect of whatever it was that you were exposed to. So now what is your responsibility as a patient? When you go home, you're supposed to identify whatever is in your environment or whatever it was that you were exposed to. Some are also allergic to flowers and plants and those things. So let's take note. Granules, any type of nut, people are allergic to them. Even paracetamol. Some people come to the hospital with swollen face, lips, and then big bumps on the skin due to paracetamol intoxication. That is why we are all different, so it can happen to anyone. Now, let's go back to where I was. When you get back home, you're supposed to cast your mind back. What did I eat in the past few hours or days prior to the allergic reaction? What did I do differently that made me to experience that reaction? Then you start writing them down. If you don't experience any again anytime soon, prepare your mind. Anytime something happens, or start removing them one by one. Maybe you used a new soap that you never used before. Try to eliminate it to see if you will still have the reaction. Or perhaps you used a perfume and it's not good for you. Or you ate something, maybe pineapple, banana, or anything. Try to cast your mind back and remember. Or if you cannot do that, if you cannot remember any of those instances, then wait. When you experience any of those things again, and you go back to the hospital. Now, the doctor doesn't live with you at home. So the doctor cannot be able to determine what it is that you are reacting to. Some of you expect that the doctor should be able to tell you what you are reacting to, but it's not possible. The doctor doesn't live with you. The doctor doesn't know the pomade you use, the soap you use, the powder you used, or the food you ate. No, it's not possible. So you have the mandate, okay, to identify the causative factor. So when it happens again, you take your mind back. What did I eat in the past 2 hours, in the past 24 hours, or maybe the past 3 days? Because the thing may be there and then start happening over a period of time. I'm trying to say in the most simple way as I can so we can all understand each other. Then start writing them down. Start eliminating some one after the other and see what exactly the problem is. Now, I've noticed something there are people that don't just keep their environments clean. You enter someone's room and there are dirty clothes scattered all over. You wear one socks like 203 times before you finally decide to put it inside water. Some people have curtains hanging on their walls for over 20 years, for several months, without attempting to even put it inside water. And then also, there's one thing that a lot of people ignore: woolen carpet. Woolen carpet traps a lot of dust. So if you're using it, make sure that you vacuum it frequently. And if it's not something that you can afford or do, then I'll suggest maybe you just go for towels, or perhaps the woolen type of the plastic type of carpet. With that, you can clean it frequently so it doesn't trap too much dust, okay, to prevent, maybe that is if you are allergic to dust. All right, and then people close their windows for so many years. At least open your doors, clean the dust, wash your curtain, vacuum your woolen carpet, or change it like I mentioned. That is if you can. Okay, allow proper ventilation, allow air to blow through your room and remove some of the scent. So for some people, because they have lived in it for so long, so their nose has become so accustomed to it, so they don't even know that the room is smelling or stuffy until they receive a visitor. Then the visitor is not really used to the scent in your room, so the visitor will come and then immediately notice that no, this scent, like there's scent in the room. So how come this person is not able to perceive it? It's because you have lived in it for so long, so you are used to it. Now, the funny thing, some people even use their curtain as napkin. They are walking past, they can't find anything nearby, so they just quickly clean their hands in the curtains. Come on, fresh girl. I mean, why would you do that? I saw someone do it recently. I went to a restaurant to buy something, and she thought no one was watching. Then quickly, she just wiped her hand in the curtain. I just looked at her and smiled. All right, so with all these things that you've scattered all over your room, and then you have a visitor visiting you, you don't expect that the person will run away, then you now come to social media lamenting, oh, this person ghosted me. Come on, you can do better. Maybe you should change your environment and change things around you to see if things will change. And now back to the allergic part. It is your responsibility to identify what you are reacting to. The doctor cannot do that for you. The doctor can only help to alleviate whatever symptoms that you are experiencing. Okay? So take care, pay attention. Your health is in your own hands. See you.